The first time I saw the Alison Lapper pregnant sculpture in Trafalgar Square, it took my breath away. The swollen belly of Lapper spoke of a body which was loved and carried life. It said, "I exist. Bodies like mine exist, and therein there is beauty. We shall no longer be invisible." However, unlike non-disabled women, our experiences of pregnancy have not been celebrated nor discussed. When I found out I was pregnant in 2017, I was filled with joy and a deep connection to my body and unborn child. Growing up, the absence of disabled women's representation in discussions on sexuality, relationships, menstruation, menopause and maternity left me feeling that my womanhood did not count, that it was vitiated by my visible physical disability. By contrast, when I was pregnant, my body was no longer just a topic of medical scrutiny, my womanhood no longer invisible. I wanted my maternity to be embraced by a healthcare system that supported me in my journey. But that was not my reality. Instead, this system was unprepared for a body like mine. Early on, I was triaged to a genetic counselling service. I was left feeling devastated. As my pregnancy progressed, there was no specialist midwifery teams, and the lack of awareness of the interaction between my disability and maternity continued. I had to be induced at 37 weeks, leading to a caesarean section. My core muscles were severely impacted. I was left debilitated. After birth, the ensuite room I was put in was inaccessible. The very space that was meant to aid my recovery became another barrier. Upon discharge, the occupational therapy team had no specialist advice on how I could breastfeed outside my home, nor carry my baby. I became increasingly dependent on family members. I was exhausted and lost my confidence. Not because of anything I'd done, but because of the structures that were meant to support me did not know how to do so. My experience came 8 years after the UN Committee on the Rights of Disabled People raised concerns that the UK had failed to mainstream disabled women's rights into healthcare. This week, the London School of Tropical Medicine has published a report which demonstrates disabled women are more likely to experience stillbirth, have lower rates of breastfeeding and endure longer postnatal hospital stays. Indeed, UK maternity policy continues to overlook women's needs. Now it's time for action. Disabled women should experience high-quality, inclusive maternity care. We need joined-up, meaningful, inclusive maternity care pathways throughout pregnancy, birth and the postnatal period to improve access, experience and outcomes for disabled women. Crucially, there must be nothing about us without us. Disabled women must be central in improving maternity care services. And whilst I met some wonderful clinicians, we must increase their understanding through better training and update clinical guidelines to secure appropriate care. Finally, we must ensure healthcare facilities, equipment and information are accessible and that reasonable adjustments to maternity wards enable disabled women to recover from birth with dignity. Yeah.